Hi students, welcome back to our Community Medicine channel. Hereafter, I am going to regularly discuss social medicine and community health questions related to NEET PG, UGC NET and also for undergraduate students because under new CBME, now MCQs are part of syllabus. Today's MCQ we are going to discuss is this question. The question is, increasing the sale of anti-asthmatics during the winter season is associated with increasing incidence of exacerbation of asthma. Which criterion of association is fulfilled by the above statement? The options are temporal association, biological plausibility, consistency of association, coherence of association. Now let us see what are these association. This association comes because we are not able to get good evidence from case control study, randomized control study. Still we are not able to prove. Under such situation, Surgeon General of Public Health Service in US and Bradford Hill have suggested if there are additional association like the next 6 things which I am going to tell you, if there is some association is existing, then even if you are not able to get evidence from case control study or randomized control study, we can still say that there is some association because of the forthcoming 6 points. To prove there is some existence of association irrespective of scientific evidence. First one is temporal association. Suppose there is an event occurring and following that event there is occurrence of a disease. For example, people ate in a marriage function previous day, next day they got food poisoning. So there is direct temporal association, very short duration. But if there is a chronic disease, people smoked a cigarette every day, but after 30-40 years, he developed lung cancer. So see the problem here. In acute disease, you can easily establish because of the timeline is very short. But if there is a chronic disease, the timeline is very big. 30-40 years we have to wait for the temporal association to happen. That's why temporal association is very good to prove a acute disease. Second one is strength of association, which is called the dose response or duration response. See the dose response, if you smoke 30-40 cigarettes, that much is the dose, then lung cancer can occur. So there is dose response relationship. Duration response relationship, if you smoke for 30-40 years daily, then there is chances of lung cancer. So there is duration response relationship. So this is another form of association. Even in this duration response, if we stop cigarette smoking for 10-20 years, the lifespan is increased. The chances of occurrence of lung cancer is decreased. So that again also is a duration response association. Third one is specificity of association, that is one-to-one association. See, if cigarette smoking causes only lung cancer, we can say there is one-to-one association. Cigarette smoking is associated with coronary heart disease, bronchitis, emphysema, cancer cervix. So if cigarette smoking causes only lung cancer, then we can say specificity is there. But cigarette smoking can cause various other problems also. So usually when there is a pinpoint specificity, it adds it adds value to the association. But when the specificity cannot be established, still we can put some arguments. However, existence of specificity is very good for association. Fourth one is consistency of association. See, cigarette smoking causes lung cancer if it is proved by a study done in India. That is one study. Same study is done in New Zealand. Same study is done in US, America. Same study is done in Africa. Same study is done in China. Same study is done in Russia. Like this, there are 50 studies done in different countries of the world. All these 50 studies show the same result, that cigarette smoking is associated positively with occurrence of lung cancer. So that means there is consistency of association. Fifth one is biological plausibility. See, the same cigarette smoking, if it causes only lung cancer, it is okay. But when it leads to cervical cancer, how it is connected? Lung and cigarette smoke is connected, but cigarette smoke and cervix, how it is connected? You cannot actually give a proper biological explanation for this. So that is one problem. But still you cannot just take biological plausibility very strongly, because it is possible that a food can cause skin cancer, but how it has caused, it needs some deeper understanding. But if there is biological plausibility, it adds a lot of strength to association. Sixthly, the last one is coherence of association. The coherence with known findings. In the history, we know that historically when people smoked more, they had more lung cancer. When women also started smoking more, then we saw more death rate among women also. So like this, we know the history, and this fact is correlating well with that known history. Then there is coherence of association. So there are 6 associations based on which we can establish a causal hypothesis. So coming back to our question, what is the answer here? Increasing sale of anti-asthmatics during winter season is associated with increasing incidence of exacerbation of asthma. So what is the answer? When there is increase in asthmatics during winter season, there is increase in sale of anti-asthmatics from the medical pharmacies. When there is food intake from a marriage hall, this is followed by food poisoning. Similarly, when there is increase in the number of asthmatics during winter season, there is increase in sale of anti-asthmatics from the medical pharmacy. So this is temporal association. I am planning to put regular videos like this. Every day I am going to discuss one topic with respect to NEET PG, UGC NET and UGPG community medicine. So kindly become a member of this channel to follow my videos regularly and support me. If you like this video, press the like button and share it with your friends. Meet you all in the next video. Until then, goodbye from Dr. Karthikeyan. Thank you.